Okay, it's recording now.
All right.
Okay, so hi guys, my name is Immaculate Christie.
And I'm Shiyang Su.
And we're going to be doing our presentation on monkeypox. All right, so what is monkeypox? Monkeypox is a disease characterized by rashes and flu-like symptoms and caused by the infection from the monkeypox virus, which is a virus that's in the same family as the virus that causes smallpox. Thankfully, it is rarely fatal, but it can be a painful disease, and there is a risk of scarring from blisters and rashes that you'll get to see a little bit later on in the signs and symptoms slide. Although they also sound similar, monkeypox and chickenpox are not, they're not related. The first human case of monkeypox was seen in 1970, and it was via between human animal transmission. But it has been, well controlled since then. But most recently, the US had an outbreak in May 2022, and it's still technically ongoing. And there were a total number of confirmed cases totaling to 27,022 in the US. But in DC, there were 505 confirmed cases, 22 hospitalizations, and thankfully, no deaths. And illness typically lasts from 2 to 4 weeks, and that's where you're considered infectious and you're still able to spread the virus. So how can you get monkeypox? So as of right now, we know for sure that you can get it through close or intimate contact. So any direct contact with the rash or scab of an infected individual, and you can also get it from touching surfaces or clothing that infected individuals have come in contact with, and as well as coming in contact with respiratory secretions of infected individuals. And as far as intimate contact goes, this includes like vaginal, anal, oral sex, since you're having direct contact with like genitals and the anus of the infected individual. And these all include hugging, kissing, prolonged face-to-face contact, as well as touching any fabric objects like involved during sex. So the infected person can spread the virus, or they're termed infectious, from the onset of symptoms, which is like the rash / like flu-like symptoms, until the rash is fully healed with a fresh layer of skin on top. Pregnant mothers who get infected can also transmit this virus to their fetus, since the virus is able to cross across the placenta. You can also get it from infected animals, since that's how the first transmission happened. You can get the virus from being scratched or bitten by an infected animal, or even eating meat or meat products from an infected animal. And there just isn't like super concrete data on transmission via like body fluids such as semen, vaginal fluids, urine, feces. When it comes to prevention, so as of right now, there's a lot of data suggesting it's primarily men who have sex with other men that are disproportionately affected. And this might have something to do with how the rectal lining is thinner, so it's easier for the virus to infect the individual. But still, regardless of sexuality and identity, anyone with close personal contact with an infected individual remains at risk. So yeah, avoid contact with people that you know that has like an ongoing infection, but if you have to be around them, social distancing is a good idea, as well as wearing face masks. And also practice good hygiene in general. If you're going out and touching surfaces, wash hands with soap and water. And if that's not available, using an alcohol-based hand sanitizer will suffice. As of right now, there is also a FDA approved vaccine for prevention, but there is an eligibility criteria. So I kind of copied this paragraph from the DC Department of Health, just because it clearly states who they're prioritizing right now to get the vaccine. And as you can see, it's a lot of people that work in like the sex work industry, just because that's kind of where you have the highest occurrences of like direct skin contact. Also, as I have previously highlighted, it's also men that are having sex with other men. And it's also people living with, they're also prioritizing people living with HIV/AIDS or people that have been diagnosed with sexually transmitted infections in the past 3 months. And this is probably due to their dampened immune system.
All right, so next I'll be talking about signs and symptoms. So just like what we talked about before, the most distinctive characteristics of the monkeypox is the rash. So as you can see from these 3 pictures, these rashes can often have different shapes, different size. They can resemble pimples and blisters, and they often end up being a scar. So this rash can occur in various parts of the body, so like genital areas, hands, feet, chest, and mouth. And they also can be painful or itchy. So just like what I talked about before, so the rash is the most characteristic symptoms of the monkeypox, because all the other symptoms can very much just like a common flu. So this can include like fever, chill, swollen lymph nodes, headache, backache, exhaustion, and muscle ache. And since the rash can occur either before or after flu symptoms, a large portion of patients can initially develop monkeypox just like flu without recognizing it. And after they develop the rash, they can be diagnosed with monkeypox. So just put in simple word, so if you have rash of any kind plus a flu-like symptoms, that's when you can suspect that you have a monkeypox. Next slide, please. So what do you do if you suspect you have a monkeypox? So as we talked about before, the monkeypox virus primarily transits through close or skin-to-skin contacts, and it can also be transmitted by touching the objects that in fact people touch, and also through animals. So the way to prevent the virus from spreading is just to cut the virus off from spreading to other people. So this include avoid sex of any kind, and also avoid body contact, and also do not share objects with other people. So this can include towels, toothbrush, sex toys, and all the things that we generally share with our intimate family members or friends. And also, since we talked about this before, monkeypox virus has been shown to be transmitted through pets. So that means that pets can spread virus to another animals or to other people. So this means that if we do have a pet at home, it is important to keep them in a safe and quarantine area for at least 21 days if you suspect that you have monkeypox or even diagnosed that you have a monkeypox. And finally, the most important thing is to get tested and get connected with your healthcare provider. So currently, the test of monkeypox involves swabbing of the rash, and this procedure can be a little bit painful and uncomfortable because we need to get the good swab of the rash to get a good specimen for the virus to show up. And so this also means that you can only get effective testing if you do develop that rash. So as I talked about before, it can be initially really hard to diagnose monkeypox if you only develop flu-like symptoms. So just keep an eye on that. And next slide, please. So finally, we want to talk about what do you do if you're diagnosed with monkeypox. So unfortunately, there is no treatment specifically for monkeypox. There's no medication or medical intervention that can like cure the monkeypox. But fortunately, most people can recover fully after 2 to 4 weeks without medical intervention. So this means that the symptoms can occur for a relatively long period of time. So 2 to 4 weeks is the average. So this means that if you do get monkeypox, just be patient and rest well. And most of the time you get recovered in that period of times. And also the important thing is to protect others. So if you do get monkeypox, you want to do just like what the last slide showed. You want to protect yourself and provide up and prevent the virus from spreading to other people. And something to do with managing the symptoms. It is recommended to keep the rashes clean and dry, and then do not touch or scratch the rash, because it is shown that the most effective way for the virus to spread is by touching the rash and accidentally touch another people. And also by touching or scratching your rash and then touch other parts of your body, you can also spread the rash to other parts of your body as well. So this also brings to the next thing is to wash your hands often, since this keeps the virus off and make sure that it doesn't spread. And like we talked about before, the virus can also spread through respiratory means. So it is recommended that infected people wear a mask at all times, especially when you're in contact with other people. And finally, see a doctor if symptoms become unmanageable. While most of the people can recover fully and develop only mild or moderate symptoms within that 2 to 4 weeks, sometimes when the symptoms become unmanageable, it's recommended to get healthcare immediately, so that the physicians can prescribe treatments or medication that can alleviate the symptoms effectively. All right, next slides.
Okay.
So yeah.
Go ahead.
So this is for more information. So we do have some of these links right here, just for your information. If you want to have a more detailed description of the monkeypox, so we have the link for the Centers for Disease Control and Prevention, and also the DC Department of Health. So these are very good resources to get a very holistic understanding of what the virus is and what you should do to prevent it, and to protect others, and what to do if you really get sick.
Okay, these are our citations, and we want to say thank you to St. Martin's of Tours Parish for watching our presentation. Thank you.
Thank you.